there, I'm Shannon Piggott with Breed Specific Healthcare, and this edition of Ask the Expert, we have Dr. Nan Boss with Best Friends Veterinary Center here to answer some questions about how to implement breed-specific wellness in your hospital. How do clients respond to this information about breed-specific wellness? And two, how does that impact the time that you spend with clients?
Larry Tilley did some lectures on cardiology for the Milwaukee VMA in the late 1990s, and one of the things he said was that a lot of dogs with DCM will start to have PVCs on an ECG screen months to years before they actually become clinical. And if you catch them at that stage and start them on medication, you can prolong their life expectancy by 2 years or more. I thought, well, I can do that. And so I created some little laminated sheets. And I trained my assistants simply to go into the room and say, please read this while you're waiting for the doctor to come in. She's going to want to talk to you about it. So a little bit of staff training. We would preload these into the file so that we could remember to do that. And we started offering ECGs, and then we started offering glaucoma screening when I got a Tonapen, and we started talking about low thyroid levels in breeds that are prone to hypothyroidism, and then we started talking about high blood pressure for Malamutes and Greyhounds who are prone to hypertension. And eventually in 2005 or 6, I finally decided I just needed to sit down and write a handout for every breed. This is what they're at risk for. These are the extra tests that we recommend, because I was doing more and more of it anyway. And so I put together these handouts, and we spent a whole year going over with every dog that came in, here's what your dog has for risk because of its genetics. And we started doing that with every puppy. Through its series of visits as a puppy, we would decide when we were going to go ahead and talk about risks when they were young. As an adult dog, when they were 2 years old, we decided 2 years is going to be the year that we talk to the client about breed risks, and then again the year after they turn senior. So we're going to keep revisiting that throughout their life. And so it became the structure and incorporated in with the rest of our client education program. So if you try and delve into this all at once, where suddenly you're going to go do breed specific and you're going to do senior care and you're going to work on dental, you're just going to overwhelm yourself. So do a little at a time, pick what topic you're going to do, and again, spend a whole year on it. GDV, we talked about, I actually did a handout on GDV, and we went in rooms for an entire year. Every dog that came in that we thought had risk for bloat got the handout, and we talked about those simple things the client can do at home. I really believe in consistency of care. I don't want to be hit and miss. I don't want to only do client education when I happen to have more time or the client asks questions. I want every client and every patient to get the opportunity to learn about what risk their pet has and what we can do about it. And so I'm going to consistently load that handout in every file for a whole year so that I catch everybody on that topic. So to me, it's all about being organized. It's about having a system and a process.
Thank you for dialing in to Ask this Expert. Dr. Boss, thank you for your time and
You're
for
very
your
welcome.
insights.